Most aesthetic practice owners are being told the same thing. Spend more on ads, hire more people, buy more tools, and hope the growth eventually justifies the overhead. But what if the smarter path is the exact opposite? Welcome back to the Business of Aesthetics podcast. I'm your host for this session, Don Adisha. And to help us rethink what profitable growth actually looks like in a modern aesthetic practice, we are joined by Dr. Sinehan Bayrak. Dr. Bayrak is a board-certified, fellowship-trained facial plastic surgeon in Philadelphia who built a fully booked practice in under 2 years without spending a dollar on paid advertising. Now, her approach challenges many of the assumptions practice owners hear every day about growth, proving that strong patient trust, strategic positioning, and operational discipline can outperform expensive marketing campaigns. Today, we are discussing how she landed her first surgical cases without paid advertising, how she turned Instagram into a powerful patient acquisition channel, and what it takes to build sustainable demand while keeping overhead under control. This episode is brought to you by Ekwa Marketing, the growth partner behind this podcast and a trusted resource in the aesthetic community. That being said, Dr. Bayrak, welcome to the podcast. It's great to have you here.
Thank you so much for having me. I'm so excited to be here, and I love talking about this stuff. So any chance or opportunity I get to do it, I'm game. So I'm really excited, and thank you for inviting me.
Amazing. It's great to have you here, Dr. Bayrak, and we really appreciate you being here. Now, let's get into the conversation. You hit fully booked in under 2 years with zero paid advertising. Mm-hmm. Walk us through the very first thing you did to put surgical cases on your calendar before you had any name recognition in Philadelphia, and what was the actual mechanism that brought in patient number 1 through patient 10?
Right. So, as a surgeon, particularly as a surgeon, so when I finished my fellowship, I immediately went into private practice, and I immediately went into a private practice that was purely cosmetic. I didn't do any insurance cases, honestly, because it's just so complicated to do insurance-based surgery now that it was easier to just, focus on the cosmetic procedures. But the reality is if that's what you're doing, you are not people are not just going to walk into your office and ask you to operate on them. That was not my experience. For my first 10 surgical patients, and probably more than that, probably my first 25 surgical patients, they were patients of mine who were actually patients for non-surgical services. So these were my filler patients. These were my neuromodulator patients. And even though I am, and at the time, of course, was a surgeon, I found value in providing new services because they allowed me the opportunity to meet people. And a very typical scenario would be I meet somebody, I'm doing their disport, and it's a tale as old as time. Dr. Bayrak, can you give me a little bit of a lift? My eyelids just feel, heavier than they used to be. I can't do my eyeshadow the way I used to. And, you can do a little bit for that with non-surgical modalities, but what a perfect conduit to the conversation of, hey, Lisa, have you ever heard about an upper blepharoplasty? It's a really very straightforward small surgical procedure. And so my first 10 cases were very organic in the sense that they typically did not start as pure surgical consults, but the non-surgical allowed me the opportunity to meet people in an area that I did not grow up in, that I am not from, that I literally just moved to. No one knew who I was.
Right. So the opportunity to meet people was really the value you were looking for. Now, when you were mentioning these smaller surgical procedures, were you also discounting them?
I wasn't discounting them. So, and there's a saying that if you ask 10 surgeons how to do something, you'll get 10 different opinions. I think that's true for any industry and in any walk of life. But to me, I saw and I knew that I was performing a service with a lot of value. And maybe it's ego, maybe it's narcissism, but I felt like I was doing it really well. I do think I'm a good surgeon. I have no problem saying that publicly. And so while I didn't discount the service, if you look back at my prices from, I don't know, how long has it been now? I don't know, 4 years ago. I mean, they're different, right? So they were lower back then, and I felt like that was fair. I felt like it still compensated me in a way that I felt was fair to me, my time, my skill. But at the same time, I think just as a business owner, you have to remain objective and you have to zoom out a little. So when I zoomed out, I saw that I was the youngest facial plastic surgeon in an area with not only lots of other plastic surgeons, but other facial plastic surgeons who just were more established. And so there is an element to, I don't think I can charge what the surgeon that's been here for 20 years is charging, but I can charge something that's fair to me and fair to the patient and adequately compensates me for my time and skill and gives the patient a result that I'm proud of and they're delighted with. So I still am, I like the saying, you don't go to Chanel and expect a discount. And I do think I provide that level of service. A lot of work goes into providing that level of service. So I'm kind of allergic to the D word a little bit, but I do think that even now, although my prices are, I would say significantly higher than they were when I first started, I still think that they accurately reflect the value that the patient is getting. And ultimately, I think that's what cost should be based on.
Mhm. And you also mentioned, well, so you stand on value. You believe your value, you stand your ground there. In those first 25 patients, what did you make people feel that I can trust her?
Yeah. A great question. For me, this question is a little challenging to answer because it's probably the least easily replicated. I find a fair amount of joy in interacting with people. I think one of the best parts of what I do for a living is I interact with people that I would hang out with, that I would go to a dinner party with. And so I think what happened there is it translated into experiences and interactions for the patient that felt very comfortable. And that's a word that I've heard and seen over the years in Google reviews and just messages patients will send in. I felt so comfortable because ultimately this is a very scary thing that people are choosing to do. Surgery in general is scary. Surgery on your face is even worse. And surgery on your face that you don't even need is like peak scary. So I think what I really tried to do for not even the first 10 patients, but really, I mean, I still try to do this today, is I try to make every visit the best part of someone's day. I try to make things seem very comfortable and accessible and tangible. And I don't want people to, like, no part of this should be any more anxiety provoking than it has to be. So, to answer your question, I really focused on making whatever the experience is, whether it's Botox, whether it's lip filler, whether it's surgery, I want that to be an awesome experience for you because really, especially starting out and even today, before I had kind of the social media presence that I have now, it was word of mouth for me, which, you can't buy that. It takes, I think, a little more work to get that. But when you have it, those are typically very high yield leads. If someone's friend is telling them, hey, I just saw this new doctor, Dr. Bayrak, she's in Westchester. It was awesome. And then they send all their friends. So I think the short version is I just try to make it such a pleasant experience for people that they can't help but tell their family, their friends, their neighbors, other moms in the carpool line. And ultimately, that is what built my practice.
Right. Thank you very much for sharing that with us, Dr. Barak. Now, that's how you first got your first few patients in, right? Now we want to understand how, or rather, how can we filter them out, especially when we're looking through your social media? So, how do you practically use your Instagram presence to filter out the wrong patient before they ever land in your consultation room? So the people you sit across from you are already pre-sold to you.
Right. Yeah. So when I first started, I had, and this applies to everybody, but when you first start, you have all the time in the world. People are not knocking down your door to see you or to come in. And so, starting out, I didn't charge a consultation fee. I didn't do any of the things I do now, which I'll tell you about. And that's because I had time. And ultimately, what ended up happening is, the limitation of my practice, like probably most surgical practices, is that there's one of me, and I can only be in one place with one person at one time. So ultimately, as things got busier, I was like, okay, I only have so many hours in the day. I can't spend 45 minutes talking about, let's say, a facelift with somebody that really is in the pre-contemplation phase, meaning they're interested, they want to learn more, but they don't really plan on doing this in the next year, maybe not even in the next 5 years. And, while those conversations are fun, because I love what I do, I enjoy talking about it. It's never a burden. It's never something that I, don't enjoy doing. The reality is like, that time should probably be spent with someone who is ready to do something in the next year. And of course, the other thing is that prices change, techniques change, availability changes. And so just in terms of planning purposes, the information that someone would get at an initial consult would not be applicable for surgery in 3 years. And so ultimately, I did a few things very slowly to meet needs that I felt popped up over time. I think the biggest advantage of social media for really any provider, it doesn't have to be a surgeon, is, and that, it can be Instagram, it can be TikTok. I like Instagram personally, but is pre-education, meaning I get on there. And to me, it's a part of my job. I enjoy doing it, but it's definitely something that sometimes I have to make myself do. But the pre-education is so valuable because what it does is it allows people to meet you without actually meeting you. So when I meet somebody now in my office, they already feel like they know me, even though obviously it's our first time in the same room. And that's so valuable because that means they already like you. And that means that they already, to some level, trust you. Otherwise, they wouldn't be there. The other thing is that you're able to distribute information on a mass scale, meaning if I have a video on how I do my facelift incisions, instead of spending 5 minutes of a consultation talking about that, we probably only spend about a minute. Because usually what people say is, I saw your video just to, it's around the ear, under the chin, right? And I'm like, yeah, that's perfect. So it really cuts down on the technical stuff we have to discuss. I mean, of course, we still review it and it's still part of the consult, but anytime we spend not doing that, we get to spend talking about what you do for work. Are you married? Are you single? Do you have children? Do you have pets? One, because I like to get to know people, but number two, because those pieces of information are also important when helping people plan logistically for surgery, because that's the part, there's doing the surgery, and then there's also helping someone figure out, okay, it's your face. It's hard to kind of work that into your life based on the things that you've told me. When do we think makes the most sense? So the pre-education is awesome. And that's probably the main reason that I put as much work and effort and time into posting on Instagram. I think the next thing I did that was really fundamental in basically streamlining consult efficiency and pre-selection is what I call the consult pre-assessment. And that's easily accessible on my website. Anyone can go look at it. And essentially what it does is it's a form. I timed myself filling it out. It's very fast. It's less than probably 3 minutes. But it collects some demographic data. It collects age, which, isn't the end all be all, but is something to consider. It collects some physical data like height and weight, because sometimes we need to optimize certain factors to get the best result for certain surgeries. And then it also collects information on, okay, have you had plastic surgery before? What kind of plastic surgery? Were you happy with it? And then ultimately, patients send in photos. This is completely free for someone to do. You could log on and you could do it right now. And I personally would look at it and say, okay, I see this, this, and this. It also has an area, of course, for patients to select what they're interested in, obviously. And so using all those pieces of information, I'm at least, mostly able to say, yes, you're a candidate for that. No, you're not a candidate for that. Here's something else I would consider, just as an expert in facial aging and facial rejuvenation. And, I think kind of the least sexy part of what I do is the cost of things, right? Because, you have to talk money, but no one wants to talk money. And it can be a little awkward. And I remember starting out, that was the hardest part for me, because they don't teach you that in medical school. They don't teach you that in residency. They don't teach you that in fellowship. But ultimately, a big piece of information for patients that they need is, how much is this going to cost me? So there's an area where patients can also see estimated costs. And then, of course, in our response to them, we also include an estimated cost for what we think a nice menu for them would be. And so patients are able to get the fundamental basic information without ever coming into the office, without ever even having an appointment with me first. And if all of that sounds good, then they are scheduled for a consultation. The most recent change I've implemented in kind of this like sequence of pre-selecting people is I do charge a small consultation fee now, and it's non-refundable. It basically pays for the time that's, we spend discussing things. And I think ultimately, to be honest with you, it's $100. It's which, you can do a lot with $100, but in this world where people are charging $250, $800, $1,000 for a consultation fee, it's kind of a drop in the bucket. But for me, it's important because it tells me that you have skin in the game, and that a patient is actually serious. I like I said, I love talking about this stuff, but at this point, there's only one of me and many more of people who are interested in surgical procedures. So I need to know that you're serious, and I need to know that you're coming to play ball, so to speak.
Right. So you prioritize accordingly.
Exactly.
So now that screening works if the audience is paying attention, right? Now that brings me to the engine behind it all. So 30,000 followers is the asset that replaced your ad budget. Let's keep the highlight reel out for a second. What does the unglamorous week to week content operation actually look like for you to keep that channel producing surgical cases? And how much of it have you systemized versus doing it yourself?
Well, I mean, I've always, I was born in 1989. I grew up without internet. And then, my generation was kind of there for, when things got really popular. So MySpace, Facebook. And so I've always enjoyed social media. At this point, it's part of my job. And that's how I see it. That's what allows me to not spend thousands on Google ads. I've never spent $1 on Google ads. And so it's important. So anytime I don't feel like doing it, I remind myself this is what gets you paid, basically. So you have to do it. And I think what people don't realize is that, the video, for example, that I posted an Instagram reel this morning. It is, I think, 1 minute and 53 seconds long, something like that. What people don't realize is that the original video was probably closer to 10 minutes long. And after you do kind of the post-production, the editing, the captions, the whatever, all the stuff, the cover photo, that it takes probably about 2 hours for one video that is less than 2 minutes long. And so social media is something that we can consume very quickly. But for me, my production time does not match the content time. And part of that is my fault, because part of that is I'm a perfectionist. I like it to look nice. I like it to be well edited. I like the sound to be optimized. I like a nice cover photo. I like a caption that's thoughtful and meaningful. There are certainly people that prioritize probably quantity over quality. I like to think I'm someplace in the middle. I will say the hardest part for me with social media, as not just a professional perfectionist, but a personal perfectionist, is no piece of content is ever going to be perfect. There are videos where I hate how my hair looks, or there are videos where there's a typo in the caption. There are videos where maybe the sound isn't great. My mic wasn't plugged in. So you have to get over that, because if you get hung up on the small imperfections, you're not going to be able to post consistently. And from what I have experienced, that is the most important thing. You have to be posting consistently. And it doesn't have to be every day, but it has to be at regular intervals. And you're not always going to feel like posting. And that's why I typically like to have, a couple videos or a couple posts in my back pocket for times when I don't feel like being on camera, for times when I just want to phone it in. But I think the best reminder for me is, there have been times where I just don't feel like doing it. And maybe I'm only posting once or twice a week, or sometimes not at all. It just depends. Life is busy. If I'm in the OR for 8-9 hours a day, the last thing I want to do when I get home is figure out what to post on Instagram. But I see, and maybe it's all in my head, but I see a difference in the inquiries and the text messages people send, and how many, consultation requests we're getting. So for me, that's like, all right, you need to get up off the couch and you need to actually do something, because you're not paying for Google ads and you're not paying for a marketing agency. And so it is all me. But that brings me to my next point, which is, there are certainly people that hire others to do this for them. And I think that that's okay. I don't know. In my opinion, I can tell the second someone is not doing it themselves. And I think patients can pick up on that too. So for me, I think just coming across as like your authentic self, as cliche as that sounds, the best way to do that is to just pick up your phone and record yourself. You don't need fancy equipment. You don't need another person. But for people that really don't want to do it at all and hire third parties to do it for them, I just don't think you're getting the same product. So unfortunately, I think I'm just going to do it myself for, as long as I can.
That's very interesting. Now, a lot of people distrust Instagram because they think, it's rewards drama and unrealistic results. What content do you intentionally avoid, even if it might get attention? Are there any particulars?
Yes, of course. I tell patients very bluntly, like, no one puts their complications on Instagram. And that's a kind of a blanket statement, because I'll take that back. There are some surgeons that will. These are the surgeons, there's like one or two of them in the world for at least like facelift surgery, where they are just so established and so good that they're not scared of doing that. Every surgeon has complications because every surgery has risks. And so there's a saying, if you're not getting any complications, you're not operating enough. So luckily for most people, it's a minority of their practice. But no, I'm not putting that on the internet, because the reality is that is not most people's experience. That is not 99% of people's experience. Now, on the flip side of that, I also don't post people that do really, really, really well, because I don't think that is an accurate representation of the typical experience. So, my goal is always to try to promote truthful, realistic information. And so there have been multiple times where I'll have someone who, let's say, is a week out from a very big surgery. So brow lift, eyelids, facelift, neck lift, fat, laser, all the things. And they look amazing. And I don't know why they look amazing, because they got the same instructions that everyone else got. They did the same things that everyone else did. And I tell them, I was like, I'm not putting you anywhere, because what is going to happen is someone is going to see that and they're going to say, well, why don't I look like her? Because she is not the norm. My job is to educate you on what the middle of the bell curve is. I think the other kind of category of things I try to avoid is anything that's really like clickbaity, right? So, like, I think a big category is commenting on, I feel bad saying this even, but because there are a lot of surgeons I respect that do this. But personally, I am not interested in commenting publicly on celebrity appearances. I just don't like, I'm not going to do a whole video on so-and-so's eyelids. I don't know. I mean, it's certainly something that I talk about with patients in the office, where they're like, I'll recommend something and they'll say, well, I don't want to look like so-and-so. And then I'll explain to them, here's what happened there. Here's what we're going to do for you. And so I just think some conversations are better had in private. So, that's just one specific example, but anything that's really like obviously clickbaity, I just think it's kind of like, I don't know. I think I'm little more sophisticated than that, honestly.
It's a personal taste.
Definitely.
Right, we're going to take a pause here. Everything Dr. Bayrak is describing today comes back to one thing. Profitable growth is not just about getting more leads, it's about knowing which patients are actually worth building your system around. And that is exactly what our partners at Ekwa Marketing do. So if you're listening to this and you're watching your cost per lead go up, sky up, your consult quality going down, or your margins getting tighter even though you're spending more on marketing, well, we are giving away our listeners a complimentary 60-minute marketing strategy meeting. So it's a one-on-one session where Ekwa's marketing analyst will help you look at where your practice is right now, where the real growth opportunities are, and what a realistic 12-month roadmap could look like for attracting more of that high-value patients without adding on unnecessary complexity. You can book that session at businessofesthetics.org/MSM. That's businessofesthetics, one word, .org/MSM. Now, let's get back to the lean growth playbook. Dr. Bayrak, let's get into the part most surgeons are afraid of, the lean operation. You deliberately chose not to hire your way to growth. What is the single most expensive thing a typical facial plastic practice overstaffs or overbuilds? And what did you replace it with so that you could stay booked without carrying that overhead?
Well, my answer to this is basically based on other things that I've read and listened to, but I think probably the biggest category of expense for most practices is wages, salaries, people. And when I was starting out, I wasn't sure what the demand for my services would be. And I also, in general, just as a person, am very, I think, financially conscious. I like to be deliberate with my spending. And so I thought, listen, I'm very realistic. People are not going to be beating down my door to be seen by me. I will be happy if I see 10 patients a week, and I can handle that. So I think the biggest expenditure for most practices is the cost of having people. And guess what? You have to pay those people whether or not you're busy. So for me, I think the decision was kind of an unconscious, subconscious one where I was like, I don't think I need anybody else right now. But ultimately, I was able to do that by relying on technology. So it's like kind of it sounds like the plot of a movie where I'm replacing people with machines. But, initially that's what I did. I chose a scheduling platform that was very intuitive for people to use. And I elected to have online scheduling. Like people could self-schedule themselves, which is a little more normal now, or you see that a little more now, but I do feel like when I was doing it for a surgeon, for really a physician to be doing it, it's kind of crazy. And I did a couple of things like that where people were like, are you serious? And so I allowed people to put themselves on my schedule. And so when you do that, just using that specific example, guess what? I don't really need a receptionist to schedule appointments. And, I chose a scheduling platform that it has like a small AI component. So, people can change their appointments after they book them with the help of like an AI messenger thing. And, I would respond to some messages myself because, again, I had the time. So ultimately, I picked something and, kind of paid for something that did multiple things for me. And I found that to be, useful. And ultimately, it costs less than a person. And then, of course, the other piece of the equation is, people can be unpredictable. Machines typically have a little more reliability. Nothing's 100%, but I can tell you that online scheduling never gets sick or takes a vacation or anything like that. So for me, the short answer is I relied heavily on technology. And when you do that, the reality is you are also, again, self-selecting people that are comfortable with technology, because that's what I needed. I needed people that could figure out how to schedule themselves online, how to fill out electronic forms, and basically how to send a text message. And so is that everybody? Probably not, but there are plenty of other practices that operate very differently that can give someone that traditional experience of, I want to pick up the phone, I want to talk to a person, I want to go to the office, and I want to fill out paper forms. That's just not me.
That's so interesting, Dr. Bayrak. It seems like you have really filtered out your whole patient funnel in a way that is very intuitive to your own personality.
I think that's true. And I think
everything around that.
Yeah, I mean, obviously, I'm no expert. I've been in practice for, it's 2026 now. I started my practice, I think it was October of 2022. And I worked somewhere else before then. So I've been doing it a little bit longer than that. But I think ultimately, just from my experience and what I've seen and heard from colleagues, I think people spend a lot of time and energy trying to attract every patient. I want to attract everybody. I want to see everybody.
Right.
And I think that's where, in the short term, does that work out well? Probably. You probably end up having a really good week or a really good month. But I think in the long term, it maybe doesn't work out so well because you end up with people or patients that you may not particularly jive with. And so for me, it was always about, I don't want to say attracting or capturing the right person, because who am I to, determine what the right patient is, but the right person for me, the right person for how my practice runs, the right person for my personality, because again, I am not performing life-saving surgery. I do elective cosmetic surgery. No one needs my services. There are plenty of very qualified surgeons in my area and beyond that can do a really nice facelift or do a really nice rhinoplasty, but ultimately it becomes a fit issue. And so for me, it was always about figuring out who I wanted and figuring out what I needed to do to get that person. I don't need to get everybody. I just need to get that person. And I think what ends up happening is, I look at my schedule and I don't dread seeing any names. I mean, everyone, if you are a provider of any sort, you know that there are times where you see someone's name on your schedule and you're like, oh God, I'm like kind of dreading that conversation. I don't really want to see that person. And that's what happens when you try to be everything for everybody. I think that's my 2 cents. I don't know.
It seems to be working out great for you.
Yeah, I mean, I can't complain. I think it has worked out for me. I do think it is a different approach because, when you're starting a business, you just want to, it's not a good feeling to not have your calendar full. And for a long time, even now, if I have, let's say someone has to cancel their appointment or reschedule, if I even have a 15-minute gap in my schedule, there is like a little voice that's like, oh my God, does everyone hate me? We got to fill that gap. What's going on? So, when in reality, it's just that, I have very much curated a very specific patient population, and I have figured out what exactly the population that I work best with. And I think that when you do that, I think it just helps what we talked about at the beginning of the podcast, which is making the experiences comfortable. I mean, the reality is that there are all sorts of different personalities, and sometimes we have interactions that feel a little more natural and enjoyable than others. And so I think if you focus on, for me, I always joke and say, I'm just trying to attract people like myself because that's what I know. I think my very typical patient is a female between the ages of, I would say, 35 to 55, knowledgeable about these things, places value on external appearance, likes to learn, but ultimately, if they're sitting in front of someone that is an expert or a professional, they say, whatever you think best, because I do think that's how people tend to get the best results. When you let the people you hire, which is kind of what's happening, do what they do day in and day out. Because I do this, I don't even want to say 5 days a week because I feel like I work 7 days a week, but I feel like I do this stuff 24/7. So let me help you. And, I figure out who that person is. And then the beauty of it is it does feel like we're just you're hanging out with a friend at your appointment.
A lot of the times during our conversation here, you mentioned that, for example, you're not working only 5 days a week, but rather 7. And like when it came to marketing, you will take the time out your schedule to do that bit. You're thinking in terms of a business owner's mindset, right? You have your surgeon mindset, but you are also now, for a lot of our business owners listening in, a pushback you might get from them, especially with regards to the lean part of it, is that lean doesn't scale. You'll cap out.
So true.
For the owner sitting there convinced that more revenue requires more staff and more square footage, what's the one operational decision you tell them to make this quarter to grow profit without growing complexity?
I think, my practice now looks very different than it did for the first 2 years. I do have more help now because I got to a point where I was like, okay, I can't, this is a different game. I think you have a decision at a certain point. You can increase your revenue without increasing your complexity or changing how your business functions on a day-to-day basis by simply raising your prices. Now, I think when you raise your prices, you need to be able to justify them. You need to be good enough to justify what you're charging. So I have done that. I am better now than I was 4 years ago, both with the non-surgical and the surgical, and my prices reflect that. Now I've increased. I think I waited probably about 2 years to increase like non-surgical pricing, and then surgical pricing is always kind of, every 6 months I try to reevaluate where I am and how that corresponds to the results that I'm producing. So I think if the question is, okay, well, how can you be more successful, financially successful, is be so good that you can justify charging more. Because it's still going to take me the same amount of time to perform the surgery. But if I'm better at it now and I can not guarantee because there is no guarantee, but if I have a higher rate of predictability and, the outcomes are worth it, then I can justify charging more. So I've done that. I've also done the other side of things where it's like, okay, I do need to increase complexity a little bit because I don't have the time to respond to messages anymore. I don't have the time to make sure that surgery patients have their labs done, their EKGs done, all that. So I have administrative help now. I have a couple nurses actually that will be, that are helping me, and they're new additions to the practice, but ultimately you do get to a point where I think you have to outsource some things. And I just try to figure out where is my time best spent? And if someone can do, a job 80% as good as I can do it. Because the other part you don't know about me that I haven't admitted is that I'm a control freak. Like, I like being involved. I think that's a good and bad thing. And I think for a long time, it was a very good thing. Everything is very curated. Every message, like a lot of thought goes into every touch point. But at a certain point, it's like, okay, I got to back off now. I've created this machine. I've done things to make sure it works well. And I need to trust someone else to do it the way, as close to how I would do it as possible. The reality is no one's ever going to do it exactly the way you would do it. And so, I think a lot of my evolution has just come from accepting those hard truths. And the reality is it works out. It's fine. And now I have more time to do things like this, to spend more time on social media where I'm communicating to more than one person at a time.
You have effectively scaled yourself in that terms. Now, Dr. Bayrak, just to wrap up our podcast here, I would love to hear one key takeaway for our audience members. What is the key takeaway from this conversation?
My gosh. I think I think people and like just human beings in general are very perceptive. And I'm specifically talking about patients. And so, if you go online, or really even if you just, you think about another surgeon's practice, I think, or another provider's practice, it doesn't have to be surgery. I think we have to figure out there needs to be less focus on so and so is doing really well. I want to replicate that. Because what works for one person may not work for another. And so I've had many, many, many phone calls with people, surgeons specifically over the years, that are like, I heard you talk at whatever conference. How did you do it? I want to do that. And I'm very upfront about, you have to be willing to work not during business hours. You also have to have the personality and patience for, I think, the type of practice that I definitely had starting out and still pretty much have to this day. Like I'm still very involved. Some people do not want to be involved to that level. And I think that's really important to figure out in yourself, because there's nothing worse than trying to replicate what may not work for you, because people can tell. It's just like, I was just listening to, a podcast episode this morning, and they were talking about how, not everyone can do the same thing on social media. So some people are really good at dancing. Trust me when I say, you do not want to see me dance on the internet. So I'm not going to do that. I know that it's not part of my personality. I also don't think I'm a great dancer. So you have to figure out ultimately what works for you. Focus on that and don't worry about what everyone else is doing. I think that's where not only a lot of people get lost, but I think for your audience, it just doesn't feel authentic. And it feels a little disingenuous to them. And not because you're trying to be that way, but because you haven't really quite figured out who you want to be and how you want to convey that. So I think ultimately, just don't worry about what everyone else is doing. Do what feels natural to you. And I think the rest just comes.
Check. And what a great way to end this session. Dr. Bayrak, where can our listeners find you and learn more about your work?
So my website is www.bayrakmd.com, Bayrak. A lot of people like to put a C in there, but unfortunately there's no C. But I am probably the most active on Instagram, and my handle is dr.bayrak, Bayrak, on Instagram. I think it's the same on TikTok, but to be honest with you, I'm not really on there much. So I spend most of my time on Instagram. I have fun with it. I post some educational stuff, a lot of before and afters if that's something that someone's interested in, but that's typically where I am.
That's great. So Dr. Sinehan Bayrak, thank you so much for joining us today.
Thank you for having me. It's been a pleasure.
Absolutely. Now, as we wrap up, if you are looking for clarity on the digital side of your own practice, Ekwa Marketing is giving away our listeners a complimentary 60-minute strategy session. It's simply a one-on-one conversation to help you map out a realistic 12-month roadmap for attracting high-value patients without adding on unnecessary complexity. So you can easily grab your time that works for you at Business of Aesthetics. That's one word, businessofesthetics.org/MSM. I'll repeat that one last time, businessofesthetics.org/MSM. I'm Dan Disha, and this has been the Business of Aesthetics podcast. Thanks for listening. Keep on building. We'll see you on the next one. Take care.